Slide 1. We're now going to be getting into Chapter 2, which is about the research topic, purpose, question, hypotheses, and clinical questions. Research topics generally are focused on key issues for practice or education or administration. Examples include chronic pain, acute pain, self-care, coping, etc. A research topic is a concept or a broad issue that's important to nursing and can be usually found in the title of the article. It is the problem or area of concern that provides the basis for developing the research purpose. So at this point, what I'd like you to do is take out a piece of paper, and I want you to write down these words in order, top to bottom. 1 is topic. 2 is problem/gap. 3 is the purpose. 4 is the objectives. 5 is the questions. And 6 are the hypotheses. And I'm going to be talking about each of these during this lecture, but I want you to kind of keep them in mind as we move along. Well, what exactly is a research problem? It is an area of concern or a gap in the knowledge needed for practice. Since we don't want to waste research dollars, we want to spend that money and time in researching things which don't have any information in our databases. Instead of researching the same topic over and over again, is not going to build our body of knowledge for our profession. Generally, it is current and an important area of concern for the profession. And there may be 1 or 2 key studies that have been conducted related to the problem, but not a lot is usually known. Problem statements generally appear early in a research report and are often interwoven with a review of the literature, which provides context by documenting the knowledge gaps. We're going to talk about that in a minute. Now, what I want you to keep in mind is that the review of the literature starts with the very first word after the abstract in the article and goes all the way up to the section of the article labeled methods. And I want you to remember this because it's very important. What are sources of problems for nursing research? 1 is nursing practice, and I'm sure that if you've been to clinical recently, you yourself can pick up what kind of problems there are in nursing. For the present time being, the number of patients to nurse ratio, the number of MRSA events on a unit of your floor, lateral violence. These are several of the issues that are of importance for nursing. There can also be researcher and peer interaction. Researcher and peer interaction would be like when Dr. Kostafich or Dr. Paraditz and myself get together and we start discussing maybe what we want to do as a research study. So we can come up with problems in that way. You can also go in and review the literature and to see, like I talked about in the first lecture, if you were studying what type of yellow gown is the best to take care of MRSA patients, and you really can't find anything in the literature on it, then it's time to do a research study. Theory can also be a great way to figure out a research study, such as going into some of the theories that you learned in prior courses, such as Orum's self-deficit, King's theory of goal attainment, and those other nursing theorists who have given us very good frameworks to conduct research from. And then there are research priorities that come from the National Institute of Nursing Research. Every year they put out what they're going to fund that particular year, which gives directions for nurse researchers. Okay. Now, key phrases to find the problem, or what I'm going to call the gap, includes finding within that review of the literature little is known about, or few studies have been done regarding, or findings of the previous studies are conflicting regarding. Because what you're going to have to do as a researcher is stand up in front of a bunch of people who have money, which I'm going to call the blue suits, and you have to ask them to fund your research. So you need to give them a reason for giving you the money, which is a gap in the literature. The purpose statement. Purpose statement should jump out from the article that you're reading and grab you right around the throat. It is a very clear, concise statement. It is about the goal, the aim, the focus, or the objective of the study. It usually includes the variables, the population, and the setting. The goal or aim of the study may be to identify, or to describe, or to explain a situation, or predict a solution to the problem. The purpose statement is often presented after the problem or the literature review. Many times they'll put it right at the end of the literature review before the researcher moves into describing the methods that they used. For example, a purpose statement might be a prospective study to evaluate the benefits of long-term monitoring of blood glucose in hospitalized diabetic children. Now, in that statement, the variable is benefits of long-term monitoring of blood glucose. The population is diabetic children, and the setting is the hospital. I kind of want you to keep this statement in mind because I'm going to refer to it later in the lecture. Now, research objectives are declarative statements that focus on the identification and the description of variables or concepts, and sometimes on determination of relationships of variables. It's a little more specific than the purpose statement. Research objectives. Some of these examples of research objectives would be describe the self-reported physical and mental health, disability level, and social support of persons chronically ill with MS. Or contrast rural and urban residents in relation to health description, social support, and perception of health. Using our first example, an objective may be a prospective study to evaluate hemoglobin A1C levels, hospitalizations for DKA, kidney function, glaucoma, and neurologic function with long-term self-monitoring of blood glucose in children with type 1 diabetes. As you can see, it's a little bit more specific than that first purpose statement that I brought up. Research questions, on the other hand, are interrogative statements that focus on the variables or concepts to be described and what relationships might exist among them. Research questions may be, what is the relationship between reported depressive symptoms and the rate of return to work for patients following cardiac surgery? Or, what is the relationship of anxiety and compliance with medications and follow-up appointments for patients following cardiac surgery? As you can see, the difference between the purpose and the research question is that the statement is in the form of a question. Now, what are hypotheses? Well, it's definition is that it's a formal statement of the expected relationship among variables. The hypotheses translate that research problem that we just talked about and the research purpose into a very clear explanation or prediction of the expected results or outcomes of the study. A clearly stated hypothesis includes the variables to be manipulated or measured. We're going to talk about them in a minute. Identifies the population to be examined and indicates the proposed outcomes for the study. Hypotheses also influence study design, which we'll be getting into in a few more lectures, sampling technique, data collection analysis method, and interpretation of the findings. Using our former example, it could be stated that a prospective study to show that there will be a decrease in hemoglobin A1C levels, reduction in hospitalizations for DKA, normal kidney function, vision, and neurologic function, with long-term monitoring of blood glucose levels in children with type 1 diabetes. As you can see, the researcher is kind of sticking his neck out and saying that this is what is going to happen if we use long-term monitoring of blood glucoses in children with type 1 diabetes. Now, there are several different types of hypotheses. There's simple versus complex, non-directional versus directional, causal versus associative, and statistical or the null versus research. We're going to focus on the first two. The statistical versus the research we're going to address when we get to the lectures on statistics. Now, a simple hypothesis states the relationship between two variables, such as smoking is related to lung cancer. A complex hypothesis predicts the relationship among three or more variables, such as smoking, genetics, and pollution together are related to lung cancer. Complex hypotheses have the power to predict an outcome better than just simple hypotheses. Now, a non-directional hypothesis states that a relationship exists but does not predict the nature of that relationship. The researcher in this instance is kind of hedging her bets. She may stand up in front of the blue suits and say, there will be a change in hemoglobin A1C levels with long-term monitoring of blood glucose values. Well, a change could mean they went up. A change could mean they went down. So if later she has to stand in front of the blue suits and give her findings, and it showed an increase in hemoglobin A1C levels, she can say to them, well, I didn't say that there would be a decrease. I only said that there was going to be a change. On the other hand, a directional hypothesis states the nature of a positive or negative direction between two or more variables. Directional hypotheses are usually developed from theoretical statements, findings of previous studies, and clinical experiences. As the knowledge on which the study is based increases, the researcher is able to make a prediction about the direction of the relationship between the variables being studied. The use of terms such as less, more, increase, decrease, greater, higher, and lower in a hypothesis indicates the direction of a relationship. And in our hemoglobin A1C study, the researcher want to say that long-term monitoring of blood glucose levels in children with type 1 diabetes will result in a decrease in hemoglobin A1C levels. A causal hypothesis, on the other hand, indicates a cause and effect relationship between two or more variables, which are referred to as independent and dependent variables. And we're going to talk more about this in a minute. Now, what I want you to hear and keep in mind with all research, since you're not only for this course, but for your entire life, association relationships do not indicate cause and effect. So when you hear on the television or you hear from the internet or wherever you get your news sources from, that they see that there has been a link between coffee consumption and a decrease in Alzheimer's, you will remember that Professor Florzak said associative relationships, by that term link, do not indicate cause and effect. Okay, so you can't always say that drinking caffeine will decrease the amount of Alzheimer's disease. So be very careful about that. What are variables? Variables are qualities, properties, or characteristics of persons, things, or situations that are manipulated or measured in research. Within the context of a qualitative research investigation, concepts are usually referred to as variables. A variable, as the name implies, is something that varies. Weight, blood pressure, anxiety, and body temperature are all examples of things that vary from one person to the next. Nearly all aspects of human beings vary. The bulk of all quantitative research is aimed at trying to understand how or why things vary and learn how differences in one are related to differences in the other. A variable, then, is any quality of a person, group, or situation that varies or takes on different values, typically numerical values. And to kind of give you a better understanding, if you look at the slide and see the brown Oxford shoes, if everybody was born wearing brown Oxford shoes and never changed in a lifetime, they were all the same size and the same shape, why in the world would you have to measure brown shoes? Whereas if you look at the pile of the shoes on the other half of the slide, you can ask several questions about it. One is, how many women are wearing yellow boots? Or another, how many men are wearing purple and yellow tennis shoes? Or what kind of person wears a slingback heel? Answers to these questions will actually help manufacturers of shoes to determine how many to make. But if people only wear shoes that are brown Oxford of the same size, there'd be no point to it. Now, there are different types of variables: independent, dependent, research, extraneous, and demographic variables. Now, the relationship between independent and dependent variables is the basis for formulating hypotheses for correlational, quasi-experimental, and experimental studies. And we're going to get into this when we get into design. However, what you need to remember is the independent variable is the activity that is carried out by the researcher to create an effect on the dependent variable. And in our example of hemoglobin A1C levels and measuring long-term glucose monitoring, hemoglobin A1C variable is the dependent variable because monitoring blood glucose values is the independent variable and affects the dependent variable. The dependent variable can also be understood as the outcome. Now, research variables are used when the intent of the study is to observe or measure variables as they exist in a natural setting without the implementation of a treatment. Thus, no independent variables are manipulated and no cause and effect relationships are examined. For example, how many people had H1N1 flu in a population? Extraneous variables exist in all studies and can affect the measurement of the study variables and the relationships among these variables. You're going to learn in this class that extraneous variables are villains in quantitative research, and all they do is muck up the study. Demographic variables are those characteristics that are collected to describe the sample. And you have all been involved in filling out forms about demographic variables, such as what is your age, what is your marital status, what is your ethnicity, how much money do you make, what year did you graduate from high school, etc. What we've been discussing in this lecture up to this point is about research questions. However, there are questions that are involved in evidence-based practice, which are the PICO question. This is where you would have a question about some clinical problem on your unit. You would develop the question, and then you would go into the literature database at the library and find the answer to your question. PICO questions have 4 components. One is the population, which is the individual patient or group of patients with a particular condition or healthcare problem. And then, the example that I've used in the past have been patients hospitalized who get MRSA. The intervention is that particular aspect of healthcare that is of interest to the nurse or the healthcare team. And what was of interest in that? Well, what is the best yellow gown to use when taking care of patients with MRSA? The comparison intervention is the standard of care or no intervention. And in this case, it may be a particular company who provides the yellow gowns for your unit, but has been shown not to prevent the spread of the infection. And the outcome is a more effective outcome. So, like I told you in past lectures, that we would go and find a better yellow gown, put it out on the unit, and see what happens. See if the infection rate actually decreases. Now, when you come to class this week, I'm going to have you work on developing some PICO questions, and we're going to talk a little bit about systematic reviews.